Hi, my name is Candice Bailey, and I'm the communications manager at the Center for Tobacco Control at Makerere University in Uganda. I think what evokes my passion for tobacco control is my desire to make a difference. I want to spark change amongst Africans. I believe that we can make a difference if we try. I come from a place in South Africa which has some of the highest tobacco usage rates and prevalence rates in the continent. And I think that I've seen firsthand the effects of tobacco use on young people, on old people, and on our communities. And we need to change that, and we need to make a difference.
My name is Judith Noel Shekumo. I'm the Executive Secretary at the Cameroonian Coalition Against Tobacco. What I'm passionate about in tobacco control issue is the child protection, because I love children. My goal is to protect them against the industrial giants. What revolts me the most is to see the authorities let themselves be corrupted, let themselves be distracted by the industry, and make sure that young people are left alone to face dangerous products by themselves. My main objective in the fight against tobacco is to protect young people and to contribute in my own way to the protection of the interference of the tobacco industry in the policies and fights against smoking. I am Leu Camara. Tobacco consumption is a common practice in Mauritania. It is especially common among young people and women. This is why we can see the strong consequences on reproductive health and respiratory disease. Children who live with smokers are most at risk of lung disease and early death. These are the reasons that drive me to fight against smoking in Mauritania.
Asaba Linda, the Programs Manager and in charge of tobacco control with Uganda Health Communication Alliance. The urge to make a contribution to save humanity from the silent killers such as tobacco use and to hold the industry accountable are some of the interests that invoke my passion in tobacco control. Remember, it is a joint effort that will ensure a tobacco-free generation.
Bom dia, chamo Marilena Simbine.
Good morning. I am Maria Simbine. I work at the Ministry of Health. I am a clinical psychologist, and I also work with the issue of tobacco. What moves me to work with this issue of tobacco is because in order to have a young, healthy generation, we must have a society that is free of both tobacco and smoking and all the harmful effects that tobacco brings, and also to have the possibility of having the free habit of being able to say no. The tobacco industry is very enticing, so it is important that we can remain here on the issue of the harms of tobacco for this generation and also for the generations to come. For the new generation, why? Because tobacco harms not only those who smoke, but also those around smokers. So it is extremely important that we can put our hand on our conscience and make everyone aware that tobacco is bad and harmful. Tobacco is bad for me, but it is also bad for you. So this is the view that I would like to see also in the policies, laws, that we could be more hard-handed when it comes to tobacco legislation. This issue of the tobacco industry sponsoring advertising on a large scale is a factor that is really not beneficial because it entices people, youth in particular, into something that is bad for them and that unfortunately they are not aware of. So now to tobacco.
My name is Patsina Piri, a communications officer for Center for Primary Care Research. We have a project under the Campaign for Tobacco-Free Kids. And what really invokes my my passion in tobacco control is seeing so many lives dying out of ignorance. So it gave me a lot of passion to see a change, behavioral change in the people, to come to know that there are harms, in smoking, there are harms in tobacco, and seeing that, they begin to quit.
Hello, my name is Petronella Chirau from the Africa Center for Tobacco Industry Monitoring and Policy Research. I am passionate about tobacco control. I dream of a tobacco-free world and a tobacco-free generation, a time where our children will not have to fight for clean air. We know the medical consequences of tobacco use, including secondhand exposure. Communities need to make efforts to reduce initiation of smoking, decrease exposure to smoke, and increase cessation. We need to save the next generation and save our children from addiction. We have a long way to go, and the time to act is now.
My name is Sharon Nyatanza, and I'm a lawyer focused on tobacco control work. And what drives my passion for tobacco control is knowing that we are doing the right thing, especially for Africa, which is a young continent. It's important for us to stop the young people from starting to smoke and to encourage those people who smoke to stop smoking. And that will make significant contributions to sustainable development in Africa and also in attaining the most basic human rights.
My name is Silveria Lodge from Uganda. My passion for tobacco control is the public health burden, the cry and the cases that tobacco is contributing to cancer. When you go to our cancer institute, the large number of patients there, you find that it is tobacco that has contributed to their cancer.
I'm Simforose Mayuna from the Association for Social Wellbeing, a Beninese NGO. 6 years ago, I became involved in the fight against tobacco, and I understood how harmful it is to be exposed to tobacco smoke even when you don't use it. I also saw the tactics used by the tobacco industry to keep smokers in the addiction and to recruit new smokers. It is urgent that as many people as possible can be informed so that the health, finance, and lives of the most vulnerable are spared.